that has been done across the main counties in the country.
In 2023, Kenya recorded an estimated 2.85 million pregnancies, according to the Incidence of Induced Abortions and the Severity of Abortion Complications Report 2023 by the Ministry of Health and the African Population and Health Research Center. Shockingly, over half of those, 1.4 million, were unintended. Even more concerning, approximately 792,000 of those pregnancies ended in induced abortions, translating to 57 abortions per 1,000 women of reproductive age, a steep rise compared to previous years.
Unintended pregnancies have reduced. However, abortion rates have slightly increased. What this means is that there's the pressures of society around women and families wanting fewer children. Unintended pregnancies have reduced because there have been efforts by stakeholders to improve access to family planning, which is really important.
Maggie Giorgio of Guttmacher Institute reckons that the preference for smaller families could be driving the need for unsafe abortion even among those who are in stable relationships.
So we found that the majority of women who sought post-abortion care, but also who induced abortions, were married. And this is common. We see this in studies that we do all over the world and all over Africa, so this is not an outlier. Many married women realize at a certain point they either want to have an abortion because they are worried about the spacing of their families. Maybe they just had a baby and they're not ready to have another one.
Highest abortion rates were recorded in Nairobi and central Kenya, up to 78 abortions per 1,000 women. Nyanza and Western followed closely at 69 per 1,000 women. The highest unintended pregnancy rate was in Nyanza and Western at 135 per 1,000 women, and the lowest was about half of that in Coast and Northeastern at 71 per 1,000 women. Yet, despite the growing need, only 18% of Kenya's primary healthcare facilities are equipped to provide post-abortion care.
When health facilities at the primary level cannot provide post-abortion care, then it means they act as a relaying belt. They arrive there and then they're referred upwards, which then creates overcrowding within health facilities at level 4s and 5s. That ultimately also reduces the experiences of women because they get there, there's a long line, a long waiting time, and also the complication may worsen. So one of the recommendations we have is to improve the capacity and strengthen the capacity of primary facilities, the dispensaries and the health centers.
Experts warn that unsafe abortions not only risk lives but also cost the government billions of post-abortion care. Maria Ambo reporting for Easy Friday.